I started to sort of dip very deeply into a depression and anxiety. More importantly, I started to suffer from panic attacks because I couldn't cope with what was happening around me. I think it was too much pressure from all angles, and you don't feel confident that you can do it yourself. I felt embarrassed to ask for help. I reached out to a lot of friends who had had babies, and I asked them if they had gone through this, and every single woman said yes, but not one woman explained, watch out, this is going to happen to you during your pregnancy or after you post your pregnancy.
After giving birth, did you find that you had frequent crying spells? Or you often felt anxious, restless, and unhappy about being a parent? These may be among the first signs of postpartum depression. Is this condition treatable? What happens if left untreated? Hello and welcome. I'm your host, Zama Buthelezi. Signing with us is Trifosa Nzolengwe. Today on Vital Signs, we focus on postpartum depression, also known as PPD. So what's coming up on the program? We speak to a woman who developed postpartum depression after giving birth. We then speak to a clinical psychologist about postpartum depression, or as some say, postnatal depression. Afterwards, we give you an update as usual on our latest South African COVID-19 numbers. And lastly, Dr. Marlene McKay will answer all your questions about COVID-19 symptoms. Remember, you can be part of the show by asking our guest some of your questions on your mind, or you could simply share your views on what we're discussing. The number to call is 011-714-5861 or 5877. You can also share your thoughts with us on social media via Twitter using it SABC Vital Signs, or on our Facebook page SABC Vital Signs. Vital Signs continue right after the break when we speak to a woman who developed postpartum depression. Please stay with us. Most new moms experience postpartum baby blues after childbirth, which commonly include mood swings, crying spells, anxiety, and difficulty sleeping. Baby blues typically begin within the first 2 or 3 days after delivery and may last for up to 2 weeks. But some new moms experience a more severe, long-lasting form of depression known as postpartum depression. Rarely, an extreme mood disorder called postpartum psychosis also may develop after childbirth. 41-year-old first-time mom Cindy Kruger and her husband's joy of welcoming their miracle baby turned to frustration when she developed postpartum depression shortly after arriving home from the hospital. As if that was hard enough, this family of 3 contracted COVID and had to be hospitalized. Let's listen to her story.
Cindy, thank you so much for the interview. For years, you've been trying to conceive. Just briefly, talk to me about your experience.
Our baby was an IVF baby, and we had tried to conceive for 5 years through IVF. It was a fibroids operation, as well as then going through the procedures of IVF. Unfortunately, also a miscarriage, we finally conceived thereafter during lockdown.
Was this a smooth pregnancy? I know that some women, because of lockdown, they had issues with what's going to happen to me. I can't even attend antenatal classes. It's not safe to go to hospitals. Talk to me about your experience.
The pregnancy was quite smooth, and I had a lot of family support in that sense. So it was smooth besides morning sickness every day, almost until the actual birth. And quite a bit of bed rest. But other than that, because it was lockdown, it's not like you have an entertaining lifestyle. You didn't mind being at home, and you were so afraid of COVID. or contracting COVID at some point, that, for me, it was more social distancing, staying at home, being in my private space where I knew I could feel safe being pregnant at the time. So I was really more nurturing the safety, and that stopped me from also going to postnatal classes. I didn't go to any because I felt that it was safer to just be at home because of the fear of COVID.
Cindy, women during antenatal classes are taught about the importance of breastfeeding, the importance of eating healthy and exercising. But there is one thing that most women are not taught of, which is postpartum depression. With you, did you even know what that was? Did anyone speak to you about it?
There was a lot of information on it, but I think when it comes to a pregnant mom who's battled to conceive for 5 years and miscarried, I feel like emotionally the moms maybe are not as ready to receive that information. You're so busy being told to be positive, and in IVF it's 50-50. You keep your positivity going at the same time. So for me it was more keep positive and keep that focus. I didn't want to hear. I didn't want to know about the depression. I knew it existed, but every mom thinks it's not going to happen to them. And I, unfortunately, was one of them going, this isn't going to happen to me. I'm too strong for this.
So, Cindy, in May, you gave birth to your miracle baby. And 3 days later, you had to go home and take care of this child. Talk to me about your experience when you arrived home.
The experience was so exciting in hospital, in my cocoon of support. And once we arrived at home, unfortunately, we went into a power failure unexpectedly at home, and I wasn't prepared for it. And psychologically, I also didn't realize, nurses had advised me that your hormone levels were going to sort of dip on the 3rd day. And I didn't realize all of this as I was coming home into a power failure. So the supportive family was around me to let them stay at their house for the night, which it coped better, but that unfortunately got worse because that was the beginning of the hormonal imbalance that had taken place, and the fears of you're not able to cope, you're not able to do anything to help your poor child. So it wasn't a welcoming experience coming home because unfortunately I feel that set everything off in motion for the hormonal imbalance.
Cindy, I remember that when I went home, I was very anxious and I was very worried about baby. So I couldn't sleep for days because I wanted to make sure that she was okay. And I had issues with formula and so many things. And from our conversation, you went through the same thing. Talk to me about that.
After we had arrived home and a few days later, I felt strong, confident, this weird strength of sense that I can handle this, until our second power failure happened. And it was about 3 days between the next power failure. And as that power failure happened, I had, unfortunately, a very scary experience where I started to mentally not cope. I didn't realize that from the time of hospital to 3 days post, 4 days post being at home, I hadn't been sleeping. I was suffering with anxiety and actually having insomnia and staying up the whole night. And your body doesn't realize it. You're not realizing it because you're in a coping mechanism. Because you're so worried, could the baby pass away? Or am I doing enough? Or what next do I have to do? Or if there's another power failure, am I going to be able to boil water? So all of these things were taking place. And the hardest decision for me within that week period, the first week of having my baby, was deciding whether to continue breastfeeding or going into actual medication and admitting that there's something wrong. I started to sort of dip very deeply into a depression and anxiety. More importantly, I started to suffer from panic attacks because I couldn't cope with what was happening around me. I think it was too much pressure from all angles, and you don't feel confident that you can do it yourself. I felt embarrassed to ask for help, and I felt embarrassed to tell family and friends, I'm not coping, I don't know what I'm doing. You're supposed to, as a mother, know exactly what you're doing and to do it correctly. And I wasn't doing it, or I felt I wasn't doing it correctly, even though there's no rule book telling you what to do.
Talk to me about the issue of using medication while you're breastfeeding. Did you have issues with that? Because I know some women will say, I'm not sure if this medication is going to affect my child. Did you have such issues as well?
You can go on to certain medication while you're still breastfeeding to aid and assist with depression. So don't feel that you can't. But because I wasn't sleeping, I needed to be on sort of tranquilizers to help me at nighttime to also still get sleep. But where I could wake up in between the bottle feeds, which is a lot easier than the breastfeeding. So with the breastfeeding, it was just keeping me up all night long. Anxiety, am I going to have milk? Am I going to be able to do this? So the tranquilizers that helped me, and unfortunately with that medication, I couldn't do that with breastfeeding. I had to make the decision to stop breastfeeding.
Talk to me about why you decided to come out and talk about postpartum depression.
I wanted to use my voice and the platform that's offered to me to help others, to let them know that you're an amazing mom, even though you feel like you're crashing or hiding in the toilet crying away from everyone else. You're an amazing mom, even when you admit you can't do it yourself. I am standing forward today to tell everybody exactly that. My baby daughter, myself and my hubby contracted COVID, and she was 1 month old at the time when this happened. And we were in hospital for 3 days. And it was the most scariest experience of my life. And I think I had to face the biggest fear. And that was, I was suffering with panic attacks. I was suffering with claustrophobia because that was how the postmortem depression had presented itself. And I had to face that fear on my own, crying in the ward, telling the nurses I need to get out of the isolation room. And they're going, you're not going anywhere. You are staying here. It is what it is. And I had to deal with it. And I think the only way I dealt with it was sitting there going, how can I teach others? If I've got to go through this, how many others are suffering in silence and not talking about this?
Cindy, we've seen that for women, for moms, there is so much support. But there are dads too who are new dads in your case. And as people, they're going through a lot and there's no support for them. Talk to me about your partner's experience through this whole ordeal, having a new baby at home, having a wife suffering from postpartum depression, finding out that the whole family has contracted COVID, and having to be strong for everyone. Just talk to us about that.
It was through contracting the COVID where I think my hubby really realized the strength within me, but also that I wasn't coping and that I was on almost like an adrenaline rush, that I had to survive. I had to fix everyone, because he was obviously a lot worse than me and my daughter, and had gotten sick first. And it was where he had pulled completely away from me in COVID while he was sick, completely detached from us. And you're trying to look after this baby daughter, you're sick, the baby daughter's sick, he's sick. And we got through it, and I was honest. I said to him, why have you pulled away? I felt like you weren't there. And he said to me, it's not that I wasn't there. He says, it's that I didn't know what to do to help you. And he says, and that's happened from birth. He says, I've watched you fall down and not known how to pick you up because I don't understand your hormones and what you're feeling inside. I just see Cindy has it together every day, and Cindy's running around fixing the family every day. He says, and then he saw Cindy couldn't do anything, and Cindy was crying a lot, and Cindy couldn't cope, and the smallest thing would be a trigger. And so he felt pulling away wasn't a sense of running away from responsibility. It was, I don't know what's happening. She changed in pregnancy, and then after pregnancy, she changed even further. And I couldn't understand the woman she is turning into now. And it was him and me both communicating amazingly about it, and him wanting me to share the story today about his part, and that he felt helpless. And he says, as much as there's information to read up for the wives, he says, what about the husbands? The husbands go through a form of depression. The husbands also have a dynamic change in the family with the child arriving, just like the mom does. Remember, you've had a routine of no baby in your home for how long, and then suddenly there's a baby. And not just a baby, there's a massive responsibility and a life that 360 changes. And it was both of us having to communicate, and I think this is the breakdown of the relationships, is that the men see their wives changing through the pregnancy and then horribly changing through post-pregnancy. And for the husbands, where's their support structure? And I think that this is something we should be looking into, is opportunities for both husband and wife counseling, or even husband counseling, where they get an opportunity to also speak about how they're not coping.
So thank you so much for the interview, and congratulations to you and your husband on your miracle baby, and all the best.
Zama, thank you so much for everything. I really appreciate the opportunity to speak today.
Story of many women across the globe. After the break, we speak to Cassandra Govender, a clinical psychologist, about postpartum depression. Please stay with us. The birth of a baby can trigger a jumble of powerful emotions, from excitement and joy to fear and anxiety, but it can also result in something you might not expect: depression. With the COVID pandemic across the world, many mothers feel that lockdown created a burden of constant mothering without anyone around to help, and that while virtual contacts from video calls, phone calls, text, social media messages helped, it is still inadequate. Virtual contacts meant women had to actively ask for help because friends and family couldn't see them struggling, which they felt rather amplified stresses of motherhood. Clinical psychologist Cassandra Govender joins us to speak about these challenges. Cassandra, welcome to Vital Signs. We are pleased to have you.
Yes, thank you so much for having me.
Cassandra, talk to us, what is postpartum depression?
All right, so I think everybody knows a little bit that once you have a baby, you can expect to have, lack of sleep, feeling overwhelmed, feeling anxious. And usually women have this experience for a few days. But once this extends, once these feelings start to deepen for over 2 weeks, you start to have a disconnect in your feelings. You might feel emotionless. You might feel that you can't cope and look after your baby. That's when we start to get into the realm of postpartum depression.
So, for people, especially now with COVID, and we've seen a lot of women coming out, including men, saying, I have a mental illness. Who is likely to suffer from postnatal depression? Is it women who already had mental illness, or anyone can?
Absolutely anyone. So it doesn't matter if it's your first baby, it doesn't matter if your second baby, and you can still get postpartum depression with your second child, even if you didn't get it with your first. Men and women can both get it. So anyone is really able to develop it, but there are more risk factors associated with certain types of people. Like, for example, if you've had depression before, there's a chance you might develop postpartum depression. If you are stressed, and you have a lot of stresses in your environment or during your pregnancy, that could predispose you to having it, as well as something like a pandemic happening where your whole life changes and you have so many things that you need to now manage that you didn't anticipate before. And as a result, that can also increase your risk of developing it.
Cassandra, as people, we are going through a lot. People have lost their jobs, their houses. People have lost so much. And we are all anxious. We are all depressed. Is there then a thin line between the two that would sometimes make a person feel, I can get through this. It will go away eventually, only to find that it takes longer?
Yeah, so I think it's a great question, because I think everyone's baselines are a little bit higher at the moment. They're more anxious than they usually are. They're more frustrated. They're more sad. So I think it's important to differentiate that all of these feelings are expected and typical, both in pregnancy and during this COVID time. It's about the severity, So is what I'm feeling impacting my ability to look after my baby? Is it impacting my ability to look after myself and function in a daily life? If those feelings and experiences are debilitating us such that we can't cope, well, then I think we need some extra support versus I'm going through the ups and downs that life is throwing me at the moment,
Talk about support, Cassandra. lately, it's impossible to have that. I know that when a baby was born before, you would have everyone coming to assist. But now you have new moms being alone in the house with this new baby. And there's not much help except picking up a call. And as moms, it's not easy to just pick up a phone and say, I am not coping. What should women do?
Well, I think it's challenging on both mom and dad, right? Because you used to have a support structure who was going to help you with, the cleaning of the house or the other admin tasks. And now it's just you and your partner, if you've got a partner. So both of you now have to manage sometimes working from home with your partner, because not all dads get the full amount of paternity leave, or it's only a week or two. And then they've got to go back to working online. If you've got other children, it's balancing them. So I think it's been exceptionally difficult to carry the household load, the workload, as well as having the newborn baby. And I don't think women are typically able to, or men actually, communicate that things aren't going well and know what to ask for. So I think it's so important that, families sit down and think about the support that they need. And I think if you have family members or friends that that are close to you, that have had babies, to really check in with them, because when you're in that tunnel vision of trying to cope with everything, I don't think your first thought is, I need to ask for help. It's, I need to cope. I need to try and make this work. So I think it can go a long way for families and friends to actually check in on those who've just had a baby, ask them if they need support, volunteer, offer even meals that you can drop off and send if you can't physically be in contact, can make a huge difference.
Cassandra, from your experience with your patients, would you say postpartum depression is a result of the breakdown of most marriages and just relationships?
Look, I think it can have a huge impact there. I mean, Cindy mentioned this, and there are a lot of changes that occur when you have a baby. And I don't think there's ever anything that can prepare you for it. You can read all the books, you can plan, but the reality of what happens, I think, is often not spoken about. The reality of how tough it is, how much, how little sleep you're getting, how overwhelmed you are, and what each person is supposed to do. So I think it's so essential. I definitely think it leads to a lot of resentment, frustration, anger in the relationship, lack of communication or misunderstanding. And it's important for couples to actually have a sense of communicating around these challenges beforehand. But like I said, when they start to happen, to start keeping that communication line open and both being very verbal about what they need and reaching out to support structures outside of them as well around what they need for advice, for support, and not just, letting things unfold. It's so important to consciously communicate and get involved.
Cassandra, when it comes to the issue of treatment, I know when I was talking with Cindy, there was a question about women not knowing whether treatment will have an impact on the baby. Talk to us about the treatment options available for postpartum depression.
Well, there's two options available, and I do think it's so important that we recognize a healthy mom, in whichever way or form that occurs, is the most ideal to deal with and look after a newborn. And if that means having to take medication to support you during this time, there are options available to ensure that you're still able to breastfeed, for example, or have other alternative options around this. So I think it's so important to break the stigma that the best way to be a mom is to breastfeed, and the best way to be a mom is to look after this. Ultimately, at the end of the day, the best thing for your child is for you to be healthy. And if that means looking after your mental health, then 100% go for it. So I think medication can play a big impact, because obviously there's big hormonal changes and those kinds of things which have taken place. But at the end of the day, I think there's sometimes also environmental changes which might take place, and having some sort of structure that you can talk through those, problem solves through those, are important. It's always good for the family, so the mom and the dad, the partners, to go together into an intervention so that you can talk through what's happening, because postpartum doesn't just affect me. It affects my baby. It affects my partner. So we need to be dealing with this all together. We need to be aware of what's happening together. But there's also an option then for you to go as an individual. And I highly recommend that you do both. You don't just take meds, but you also try, and even if it's for a few sessions, talk through what are some of the environmental triggers in your postpartum.
Cassandra, we have some tweets. Let me just check what we have, and then you can give us the answer. This one says, I went through postnatal depression. I pulled through. I'm grateful for that grace. Well, that's good for you. And we know some women don't. The next one, postnatal depression drove my cousin's wife to taking the life of my 2-week niece. Cassandra, talk to us about this, because we've had so many. Okay, you can answer after the break. And then there's another one that says postnatal depression is a type of depression that many parents, women, experience after having a baby. This leads to breakups and single parenting. So please, let's be aware. Hold on and read more. After the break, we continue with our discussion with Cassandra Govender, a clinical psychologist, about postpartum depression, and she'll answer the tweets I just read. Please stay with us. Caring for a new baby is challenging, and all new mothers suffer some level of mental, physical, and emotional exhaustion. Low social support is one of the key risk factors for developing postpartum depression. Social distancing measures during lockdown created so many barriers to having practical help and meaningful support from others in the weeks and months after their baby's arrival, leading many new mothers to feel totally overwhelmed. We continue our discussion with Cassandra Govender, who's a clinical psychologist. Cassandra, talk to us about the recovery time now. I know that some people will have postpartum depression and it wouldn't last long, but some will experience it longer. So talk to us about the recovery time for both.
Sure. So I think it really depends on the number of stresses that you actively have. So some moms might find that once the hormone imbalance is addressed and they start to process what has been happening to them, they start to feel better and keep going. In others, if you have ongoing stresses and ongoing challenges that cannot be addressed and sort of have to be lived with, like, for example, you're feeling very overwhelmed but you've got no support, or you don't have a partner, those are things that can then really contribute to your postpartum depression taking a little bit longer to resolve and taking a bit more time. So it really depends on how much we can both target the chemical imbalances but also the environmental and social challenges that have contributed to you developing postpartum.
Cassandra, let's talk about the triggers. I know most moms struggle with breastfeeding, and on top of that, then you have to choose the right formula, and some formula will not agree with the baby. Can these be a trigger?
Definitely. I think there's a lot of expectation that new moms have of themselves, and I think that society has that moms just know the answer. They have it figured out, they know what to do, and it will just come naturally. That's part of having maternal instincts. And I think, unfortunately, it's that ideal that can be so damaging to mom's self-esteem as well as, parents' self-esteem, because it isn't a natural thing. And I think you'll know, as you were speaking to Cindy about it, it's difficult. You're uncertain. You're not sure what to do. And I think these feelings of feeling not good enough and uncertain are not spoken about enough, that it's okay to feel like you're not sure. It's okay to ask for help. It's okay to not have all the answers and to have to figure it out. Because those are normal experiences. It's actually okay not to know. And I think that people feel bad and ashamed of that. But I also think that, dads or partners rather also may not know what their role is and what they should know and what they shouldn't know and how to support. And I think that in itself can also play a significant role in just all the anxiety around having a baby.
Cassandra, when we first spoke, you said postpartum depression doesn't just happen when you're having your first baby. It can come when you're having your second one, your third one. But won't this be seen as a sign of being weak, and hence many women decide not to say anything? Next thing you see, people killing babies.
Yeah, so I think this is a very, very complicated, discussion around this, because you have a scenario where you've had your first baby and probably didn't have postpartum depression and could actually have it in your second baby, whereas you can have it with your first child, but then again with your second child and with your next ones. So I think in these cases, it's important to remember that each pregnancy is different, coming with different responses, environmental triggers, those kind of things. Because it's also equally important to understand that you can have it with your first child, but not with your second child, even though the risks are there. But I think it's this absolute emphasis that momhood should be amazing and great and so natural, that leads people to believe that when they're feeling uncertain, when they're feeling uncomfortable, when they're actually feeling frustrated, tired, resentful, that these are not normal emotions, and it can lead you to feel like you're not being good enough, and therefore not say anything and not ask for help, and then have a very tragic incident like the tweet we saw where a baby's life was taken. And I think that is an extreme. It doesn't happen in all cases, but it's a sign of what can happen when we don't talk about these things, when we don't normalize these feelings, and when we don't say it's okay either for both partners, mom or dad, to be able to not experience this as great as you think, and to have struggles, and they should talk about it.
Cassandra, I know I've done on the show stories about the importance of antenatal classes, attending them as a mom, and also together with dads, and also about the importance of breastfeeding. But during these antenatal classes, yes, you taught about your health, the baby's health, so many things, breastfeeding, the importance, bonding with the baby. But postnatal depression is one thing that is never talked about. Do you think enough is being done to raise awareness about postpartum depression?
I think we can do more. We can always do more when it comes to our mental health. And I think the most important thing is that we need not a education in an informative sense, but in a practical sense. I think we as, if you've had a baby before, if you've parented before, to be vocal to those around you who are about to have babies about the reality of what it's like. Have those honest conversations with your children, if you're parents, with your friends, about some of the things they might experience. I think it's so important not to hand a piece of paper or give information in a technical sense, but to really help people understand in a practical, real life setting, what are things you're expecting to see? What emotions do you think will pop up? How would that manifest when you're looking after your child? When can you look at these emotions and these reactions and think, this is a problem, I need to get help? To really sensitize and say this happens and can happen to anyone, and it shouldn't be something you feel ashamed about. So I think we need to be talking more and more about this, and we need to be real about how we express motherhood and fatherhood and looking after our children, because it's not all roses and daisies. Some of it's really, really tough, and it doesn't take away from the meaningfulness of the experience, but it can save a life for someone else to hear that it is tough.
Cassandra, let me just take a caller. We have a caller from Zimbabwe. Good morning and welcome to Vital Signs.
Morning, how are you?
I'm good, thanks. And yourself? What's your question?
Okay, my question is some experiences that come after having experienced a death problem within the family. My husband passed on, but I think I've got depression because I'm failing to cope.
Did you just lost a baby?
I lost a husband.
Okay.
I lost a husband.
Okay, so now you're feeling depressed?
Yes, I am.
Okay. We are so sorry about what you're going through. Please listen to our clinical psychologist. She may be able to assist. Cassandra, can you assist her? It's Belinda from Zimbabwe.
Yes, thank you. I'm sorry for your loss, Belinda. And I think the first thing to remember is that when you go through loss, you're going to experience a number of symptoms that look like depression, but they're actually part and parcel of losing someone. So, you might find yourself struggling to sleep, to eat, wanting to withdraw, feeling isolated, angry, frustrated, sometimes numb. You're going to move through different phases of this. And it's also all right that you allow yourself to do it and to give yourself the time to really grieve and come to terms with this major loss that you're going through. But if you find that you are, feeling suicidal, you're feeling like you really cannot cope, that you don't have the support, it's always good to maybe reach out to someone professional just to speak, or even family and friends support, to speak to them and get a little bit of care that you need. But noticing that, some things you might be feeling, and this feeling of, struggling is sometimes part of the course of grieving, but knowing in yourself, if it feels too much, that you must definitely reach out for help, and to really just take care during this time. It's a difficult process coming to terms with the loss of someone as close as a husband.
Cassandra, thank you so much for a very informative interview. I honestly wish we had more time, but thank you so much. We're just going to go to break now. We'll talk to you next time. Have a great day. We're going to break. We'll come back and speak and talk to and do our COVID statistics. Please stay with us. The 7-day moving average daily number of cases has increased in South Africa. Also, there has been an increase in hospital admissions as the Delta variant, which was first identified in India, continued to spread rapidly across South African provinces. This form of the virus spreads exceptionally fast, resulting in a steep rise in new cases. For now, though, let's take a look at the national COVID-19 statistics. To date, over 16.2 million tests have been processed in South Africa. Since the first case was reported last year, 2.7 million people have tested positive for COVID-19. Over 2.4 million of them have recovered, but sadly, more than 80,000 people have died from COVID-related illnesses, and we're sending our sincere condolences to their families. More than 11 million people have been vaccinated, and government urges everyone from 18 years up to register and vaccinate to prevent severe illness and hospitalization. So what's happening in the provinces? The 7-day moving average daily numbers of cases has increased. While Gauteng remains the epicenter of the third wave of the pandemic, majority of new cases lately are from KwaZulu-Natal, the Western Cape and the Eastern Cape. For now though, let's take at the infection numbers recorded. Since the first case was recorded, over 900,000 positive cases have been recorded in Gauteng, and lately the rate of new infections has gone down in the province. Over 470,000 positive cases have been recorded in the Western Cape, but this province is observing a surge in new cases. Over 460,000 positive cases have been recorded in KwaZulu-Natal, and the province now leads with new infections. Over 260,000 positive cases have been recorded in the Eastern Cape, and the province is also seeing a surge in new cases. The remaining provinces haven't been spared, as health authorities in these provinces confirm the detection of the rapidly spreading Delta variant of the coronavirus. For instance, in Limpopo, infections have also been detected in children aged less than 12 months, and authorities believe that the variant might be responsible for the spike of positive cases that are causing the third wave of the pandemic. For now, though, let's take a look at the numbers recorded. Over 145,000 positive cases have been recorded in the Free State. Over 141,000 positive cases have been recorded in the Northwest. Over 140,000 positive cases have been recorded in Mpumalanga. Over 119,000 positive cases have been recorded in Limpopo. Over 79,000 positive cases have been recorded in the Northern Cape. So those are the statistics, but do remember that as we observe and report on the COVID-19 cases, the numbers can change, sometimes significantly. Vaccine registration is still open for those ages 18 and over. You are all urged to register and go out there in numbers to vaccinate to lower COVID severity and hospitalizations. Let us continue to take precautionary measures, and these include regularly washing our hands with soap and water, sanitizing, use sanitizers containing 70% alcohol content, wear a cloth mask that covers both our nose and mouth even after vaccination, practice social distancing and ensure proper ventilation indoors. Lastly, avoid mass gatherings. If you believe there is a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline. Their number is 0800 029 999 and alert them to your symptoms. Protect yourself to protect others. So, frustrated South Africans who have been infected with COVID-19 are in isolation at homes continue to take their frustrations with symptoms to social media in order to get medical help. But this has come back with even more frustrations as people who are giving advice are not medically trained to do so. General practitioner Dr. Marlene McKay joins us to give advice to COVID-19 patients on how to treat their symptoms at home. Dr. McKay, good morning and welcome to Vital Signs.
Again.
Dr. McKay, before we go to our questions, briefly talk to us about what people should do before vaccination. What should they eat? What should they drink? Are they supposed to take any medication for pain? Because there's so much questions around that on social media.
Yeah, I think it's very important that if you are, number one, if you are on any medication, continue with your chronic medication. Number two, we do not advise that you take anything for pain prior to the vaccine, right? If you take anti-inflammatories or painkiller, it may lower or inhibit the antibody response, so you may not get a great antibody response afterwards. However, once you get home in the evening, if you do start experiencing either headache or chills or arm pain, which is the most common side effect of the vaccine, it's perfectly appropriate to take something for pain. So after the vaccine is safe, before preferably nothing, but do continue with your chronic medication.
Dr. McKay, talk to us about the issue of alcohol, because people are not sure what is happening, whether you're not supposed to take it before or after vaccination. Does it have an impact on the vaccine?
So there's not much data about whether the alcohol or content will have a direct effect. However, alcohol can affect our behavior, and that may impact part of the antibody response. So in short, my personal view, and this is what I tell my patients, as with any medication, whenever you are prescribed something by your doctor, it's always when the pharmacist gives it to you, it always says there not to be taken with alcohol. So, and invariably, Zam, if you think of it, patients are driving to the vaccine centers, they're driving home from there. So even with that, you should not be having any alcohol. So the short answer, please do not have any alcohol at least in the 24 hours prior to your vaccine and at least 24 to 36 hours after the vaccine. Just play it safe and be responsible and avoid any alcohol.
Dr. McKay, how long does it take after vaccination for the body to build protection, immunity against the virus that causes COVID-19?
Yeah, so that's a very good question. So let's take the Johnson & Johnson vaccine first. Once you've had that vaccine, it takes at least 2 weeks, 14 days before you are regarded as being fully vaccinated. So that's important because in the first 2 weeks, you could still get COVID. It does not mean that the vaccine caused it or gave you COVID. it's normal. Even after the vaccine, as we know, it's still possible, much lower chance, but still possible to get COVID. So you're only regarded as being fully vaccinated 14 days after the J&J. With the Pfizer vaccine, it's a lot longer. Again, the vaccine takes about 2 weeks to start making an antibody response. But with the Pfizer, you have to wait at least 56 days until you are regarded as fully vaccinated. So it's dose 1, 42 days, and then you have a second dose, and then 14 days after the second dose. And that's how I get the 56 days. After that, then you are regarded as being fully vaccinated. However, Zama, even after the first dose, with that first dose, you do get quite significant protection, at least about a third, 33 to 40% protection with one dose of Pfizer. But it's absolutely vital that you get the second dose in order for you to enjoy the full protection that the Pfizer vaccine offers you.
Dr. McKay, we have a caller from Mpumalanga. Good morning and welcome to Vital Signs. What's your question?
My question is how to treat COVID symptoms if you're at home.
What symptoms do you have, ma'am?
I'm sneezing and then my throat is full and then my nose is blocked.
Okay, please listen to Dr. McKay and hopefully, Lina, you're going to be feeling better very soon. Did you hear, Lina, Dr. McKay?
Yes, Summer, yes, Summer. So there are a few principles of management of COVID at home. Number one, you must take it easy. Even if you feel okay, please don't be active. Spend time in bed at home. All right? So make sure that you're isolated away from your family. Make sure that you are resting. You're getting up to go to the bathroom and to eat and then to steam at least 3 times a day. And you can use any eucalyptus, it's old school, into a bowl of boiling water, cover your head with a towel and inhale it. I advise patients to do it at least 3 times a day. Get into the sun at least 3 to 4 times a day, 15 to 20 minutes at a time. Works very well. And then come back in and rest. And then in terms of medication, we use generally your vitamin C, vitamin D, some zinc, some magnesium, and even some vitamin D. You should be on a low-dose blood thinner, and the painkiller is fine. And sometimes we also prescribe something just to keep the chest open, like an asthma inhaler, also quite effective. And then obviously to monitor for any worsening, very, very important. If suddenly you start coughing excessively, getting short of breath, battling to speak, and your oxygen levels are dropping, even confusion, delirium, disorientation, those are severe signs and warning of danger, and that's when you need to be taken to hospital. But if you follow those procedures and those tips, generally, most patients will have a mild to moderate course of illness and get better nicely.
Dr. McKay, thank you so much for talking to us. Have a great day.
Thank you, Zama. Bye-bye.
Thank you to all our guests for your participation and to our viewers for watching Vital Signs. Don't forget, the only way to manage this pandemic is if we all play safe and protect each other. Stay at home, social distance, wash your hands and wear a mask. And remember to go and get vaccinated. I'm Zama Butelezi. Do take care.